Did you know that about half of men and women in the United States struggle with high blood pressure? It's even higher among Black adults. Social factors like education, income, and access to health care significantly impact these rates. Let's dive into why this is so important. Hello, and welcome to House Calls. I'm Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association. Did you know that social factors like access to health care and insurance can affect your health just as much as medications and lifestyle choices? They play a big role in high blood pressure, known as hypertension, which raises the risk of heart attacks and strokes. Many people with high blood pressure don't even know it. However, improving access to health care can help raise awareness and better manage those numbers. Let's talk about how we can change that. Here to talk with us about how healthcare access and high blood pressure are related is Dr. Yvonne Commodore-Mensah, a cardiovascular nurse epidemiologist and associate professor of nursing at the Johns Hopkins School of Nursing. Dr. Commodore-Mensah, welcome to House Calls.
Thank you so much for having me.
Can you tell us a little bit about your work in this area, specifically your interest in reducing heart disease risk in African people, both in the United States and Africa?
So when I was a doctoral student several years ago and I took a cardiovascular disease epidemiology course, I learned that Black people in the US were more likely to have hypertension, diabetes, kidney disease, and the list went on. There are several studies that have shown that when you look at African immigrants in the US, their awareness of hypertension may be lower than their African American counterparts. In fact, I had an experience where I went to an African shop and I was talking to the butcher about his health, and I asked him, when was the last time you went to see the doctor? And he looked at me and said, "Look at me, I'm strong." And he flexed his muscles, almost to suggest that his physical health would imply that his heart disease risk was low. And so I asked him if he knew his blood pressure numbers, and he said no. And so this is someone who had lived in the US for about 10 years and had never been to the doctor. So that's an example of how you may have African immigrants in the US who should have access to healthcare, but may not engage as well as their African American counterparts with the healthcare system.
So what individual and societal factors influence people's ability to get their blood pressure under control?
The individual and societal factors are often referred to as social determinants of health. These are the conditions in which people live, learn, play, pray, or work that influence their health. And so some of these include health insurance, healthcare access. They also include education, income, but also the neighborhood and lived environment. If an individual lives in a neighborhood that is unsafe, they are less likely to go out for a walk and be physically active. If an individual resides in a neighborhood that has an abundance of fast food locations and has limited healthy food options, often referred to as food deserts, they are less likely to adopt a healthy diet.
High blood pressure is known as a silent killer because most often people don't have any symptoms. But when blood pressure gets very high, it can cause symptoms and be an emergency. What are some of the symptoms that mean somebody should get immediate emergency medical care?
One of the most frustrating things I've heard from engaging with people who have hypertension is that when it's high, you don't know it, and when it's low, you also don't know it. But when your blood pressure remains elevated over time, it increases your risk for stroke. That's one of the complications of blood pressure that is uncontrolled over time. The good news is that there's an acronym to remember the signs to watch out for if a person is having a stroke. FAST. F stands for face. Is their mouth or face drooping? A stands for arms. Are they able to lift both arms without one dropping to the side? S stands for speech. Is their speech slurred? And T for time. Time is of the essence. Call 911. So remember, FAST, face, arms, speech, and time.
What are the challenges in recognizing and treating hypertension in under-resourced communities across the United States?
In the U.S., we know we have an issue with health disparities. Healthcare access and low health insurance rates are common issues that affect our ability to reduce the burden of hypertension in Black communities all around the U.S. It's not enough for someone to have health insurance if they don't have access to primary care providers who will screen and diagnose hypertension. Another common issue is distrust in the healthcare system. We know that the U.S. has a history of racism that may show up in many ways, and there are people in the U.S. who may still not feel comfortable going to a traditional healthcare setting to get healthcare, and that's why we need to figure out all the different ways we can meet them where they are in trusted spaces. And one of these trusted spaces may be faith-based settings, so people may miss their doctor's appointment, but they may show up to church every Sunday for years. And so how do we use that setting as a trusted space where we can bring the healthcare community to partner with these faith-based settings so that care is more convenient, that people don't have to take the day off, figure out transportation, childcare in order to have their blood pressure measured and their treatment intensified.
What other social factors contribute to higher rates of hypertension or uncontrolled hypertension in Black communities?
Education is another key social determinant of health. People who have lower levels of education are also more likely to bear a disproportionate burden of these health disparities. Another social determinant that is associated with hypertension control is income. Unfortunately, health insurance is tied to employment in many situations. So if someone loses their job, they're more likely to lose their health insurance. But also their income that they earn may affect their ability to afford certain medications, their ability to afford a blood pressure device, for instance, if they have to pay out of pocket. It may also affect the types of foods they eat. A DASH diet, or dietary approaches to stop hypertension, has been found to lower blood pressure. And a lot of the components of a DASH diet requires that a person has access to healthy foods, fruits and vegetables. A lot of these healthy foods may not be affordable to certain populations in the U.S. And that's why income also matters when it comes to improving blood pressure control.
That is such a great point, and I'm glad you brought that up. As you know, the DASH diet, or dietary approaches to stop hypertension, focuses on reducing blood pressure through healthy eating. It's rich in vegetables, fruits, and low-fat dairy, while low in saturated fat, cholesterol, and sodium. Studies showed that it not only lowers blood pressure, but also improves cholesterol levels. Reducing sodium intake alongside the DASH diet further enhances its effects, especially in those with high blood pressure. So often, hypertension isn't diagnosed and treated because people don't have their blood pressure regularly checked. Why is that?
There are common myths that are associated with hypertension that may prevent people from being diagnosed or continuing with their care. One of the myths is that when blood pressure is high, one can feel it. Unfortunately, high blood pressure often comes with no symptoms, and so someone may have hypertension for decades and not know it. Another common myth or misconception is that if a person takes treatment for a few months, they can discontinue it because they're cured of their high blood pressure. Unfortunately, hypertension may not be cured and it's a lifelong condition, but it can be controlled and managed. Another common myth among men is that most blood pressure medications are linked with sexual dysfunction. That's a myth because there are blood pressure medications that don't come with these side effects that are still effective in lowering blood pressure.
So the bottom line is, having your blood pressure checked is very important. How often should people have it checked? And if it turns out they have hypertension, what kind of treatment should they expect?
Adults 40 years and older should have their blood pressure checked at least once a year, or individuals who are at a high risk for developing hypertension, including people who have a family history of hypertension, people whose blood pressure is slightly elevated. Also, people who are overweight or obese may have to have their blood pressure checked more regularly. However, for adults between the ages of 18 to 39 years of age, the recommendation is for them to have their blood pressure checked every 3 to 5 years. With respect to treatment for hypertension, one of the first steps is to encourage the patient to adopt a healthy lifestyle, including eating a healthy diet, engaging in physical activity. If a person is overweight or obese, trying to lose weight because a healthy weight loss has been shown to lower blood pressure. Rarely do we start treatment with medications unless an individual has a strong family history for hypertension or heart disease or other risk factors. I like to say food is medicine, exercise is medicine, and they are just as powerful as medications.
Well, that's very helpful information, Dr. Commodore-Mensah. Thank you so very much for talking with us about high blood pressure and healthcare access, and thank you for joining us on House Calls.
Thank you so much for having me.
Let's recap some key takeaways. African immigrants tend to have lower awareness about high blood pressure than African Americans, even though they have access to healthcare. Cultural beliefs and less involvement with the healthcare system contribute to this. Income, education, and neighborhood conditions affect how well people can manage high blood pressure. Limited access to healthy foods and safe places to be physically active make it harder to adopt healthy habits. Black communities with fewer resources struggle with healthcare access and trust. Community-based approaches like partnering with churches can help improve engagement and blood pressure control. If you have questions about health conditions, I'd love to hear from you. Comment below, hit subscribe, join me here next time for Answers You Can Trust.